Are you suffering from symptoms like debilitating fatigue, brain fog, muscle pains, dizziness, and particularly have those symptoms not been explained by your medical doctor? If that's the case, then you may be suffering from ME or chronic fatigue. So the first thing I want to say is, if you are suffering from these types of symptoms, it is absolutely critical that you go and see your general medical practitioner. There are a whole bunch of different factors that could be causing these symptoms. In fact, this brings us to our first sign that you shouldn't ignore with ME chronic fatigue syndrome, and that is that your symptoms are medically unexplained. ME chronic fatigue is a medically unexplained group of illnesses, and that's because there is no biomarker, there's no single test that you can do that will diagnose you with ME or chronic fatigue. It is a diagnosis by exclusion. What that means is you've had appropriate medical investigation and testing. And if you haven't done that, there is a significant risk that there is something that could be causing your symptoms that is not being addressed. So the first clue, the first sign that you may have ME chronic fatigue is that you have medically unexplained fatigue-related symptoms. The second sign is that these symptoms of fatigue are not alleviated by rest. They're also not proportional to the amount of activity that you are doing. If you have lived in a severely stressful environment for a sustained period of time, it is appropriate that it may take a period of time for your body to recover. So if there has been significant loads on your system, there may be time to recover. It may also be the case that your fatigue is because you are constantly pushing beyond your boundaries. But the key thing is, in a healthy, functioning body, we have stress and we have recovery. We have activity and we have recovery. And if you're experiencing symptoms that are disproportionate to the activity and you're not recovering, that's another clue that you may be suffering from ME or chronic fatigue syndrome. The third thing to look out for is some of the other symptoms that may go alongside. If we take the Fukuda definition of ME chronic fatigue, and there's a number of different diagnostic sets of criteria, in addition to having experienced debilitating fatigue for 6 months or more, there also needs to be the presence of 4 or more of the following symptoms. Minor complaints alongside fatigue may include cognitive impairment, sore throat, tender cervical or axillary lymph nodes, muscle pain, muscle joint pain, headaches of a new type, pattern or severity at onset, unrefreshing sleep, and post-exertional malaise. In fact, that symptom of post-exertional malaise is a particularly defining characteristic of ME chronic fatigue. That's when you do something, you may be okay a day or two afterwards, and then you crash. That is a classic sign of ME chronic fatigue and is actually explained by our cycling of adenosine triphosphate, ATP, not happening as effectively as it should. Now, here's the important thing. If you are suffering with ME or chronic fatigue syndrome, there are answers. Here's a clue. ME, chronic fatigue, and we can also include in this fibromyalgia, long COVID, post-viral fatigue, Lyme disease, and so on. These are labels for a set of symptoms. They are not really a diagnosis of what is happening, why it's happening, where it's happening in your body. Here at the Optimum Health Clinic, and you'll find many videos here on our YouTube channel explaining this in some more detail, but here at the Optimum Health Clinic, we recognize there are different subgroups, there are different stages to the illness and recovery process, there are different systems that are impacted. To really map your path to recovery, we have to first decode what's happening in your body. To find out more about how to do that, do check out my book on fatigue, Decode Your Fatigue, where I share some of the best of what we've learnt here at the Optimum Health Clinic over the last 20 years. And if you'd like to book a free discovery call to talk to one of our team to explore how the Optimum Health Clinic approach may be helpful to you, then you can do that at theoptimumhealthclinic.com. I hope that's been helpful. Thank you for watching.